population, but we still have work to do. So to the extent that this is helpful for the data we do know, let's make sure that we work together to get to all of these different population groups to make sure that they have access to vaccine. They're hearing from people that look like them, spend time in the same places, visit the same establishments. We really want to make sure that vaccine is widely available. Same thing on ethnicity. The data is still missing a significant number here. This data is all reported by healthcare providers to the state health department, and then we get access to that data. So we can only work off the data that we have available to us. So we're really trying to work with the state to get better access to data to really look at this. Importantly, another important demographic breakdown is the sex, female versus male. We have many more females than males getting vaccinated. So for the men on the group, encourage your peers to be vaccinated. We want those numbers to better reflect our population as well. And ultimately make sure that across our demographics, that our demographics match those who have been vaccinated. On the top left, to just draw your attention to the number of vaccination sites. So over 210 sites are reporting data and are vaccinating people around DuPage County, which is incredible. We've come a long way. And it'll be important as we move away from these mass vaccination sites that people can get vaccinated at their doctor, at their pharmacist, at a place that is comfortable to them. More and more places should have access to vaccine.
Can I ask a question?
Sure, go ahead, Michael.
Can you go back to that last slide?
Yeah.
Is this slide showing that it's at 3.2% of the Black population has been vaccinated, or 3.2% of that 4.6%? I'm kind of confused about that number.
Yeah, good question. So that's this 3.2% in the Black population is the percent of all vaccine recipients. So there were 411,000 people who have received first doses. 3% have been Black. So you would expect if we got everybody in the Black community vaccinated, that number would be closer to 4.6. Okay. So it represents of all the first doses administered who received those. So we still have a gap between 4.6. That's what percentage in the general population versus those who have been vaccinated. Does that help?
Yeah.
And Chris, may I jump in and
sure.
Forgive me, I'm going out on a platform that I'm not very sure of, but it also looks to me like we have still that 33% that are unknown. So that 3.2% is of those who have expressed their race. That's the number that we know. And that's not a whole lot of comfort. It's not an answer, but it's a part of the equation.
Yes, yeah. So 33% of those who have been vaccinated, we don't have data about what their race is. So that represents about 137,000 people that have been vaccinated that we don't know how they identify. So that is a limitation. And those are probably scattered across these different race groups. But yeah, it's not great consolation because we'd love to know for everybody how they identify so that we know where we need to spend more time.
And Chris, it's Adam.
Hey, Adam.
Can you hear me?
Yep.
Yeah, the one other just clarification and qualifier, right? Like that's the percentage of the shots given at sites in DuPage County. So it's not DuPage County residents. It's not the share of DuPage County residents.
Great point. Yeah, that's an important distinction. This is where we start getting into all the data caveats. So this data is about anybody that's been vaccinated at a site in DuPage County. So if I can draw your attention to the bottom rows, the county of residence, of this data, about 40% are people that don't live in DuPage County. So those may be people that work here, but don't live in the county. This data that we're looking at right now is about anybody who'd been vaccinated in DuPage County, regardless of where they live. So this could be somebody that lives in Winnebago County, but works here at an employer in DuPage and was vaccinated here. So yeah, that's an important note, Adam. Thanks.
Chris, if I could add one more coda to what I just said, I take this number to say we have a lot of work to do, and that's why we're here. It's really important that we're paying attention to this. We want to be precise about it, what it is, but one of the things it really is a marker to us for action.
Yep.
And David and Chris and Adam, if I might follow, this is Jan Geider. I have a question. Is there a way, and maybe Mary Keating can chime in on this, is there a way that we can assess the areas where we know we have a larger population of low-income residents, and not just low-income, but African-American and Latinx, to determine what percentage or numbers of those families living in our low-income housing have been vaccinated. I mean, that would help us better target. I'm learning from this experience of Shots of Hope. And Chris, I hope you don't mind. I didn't think you trademarked Shots of Hope, so we use that. But I'm learning from this experience that I feel like we're kind of just shooting in the dark, because we don't know how many people in some of these housing complexes have been vaccinated.
Yeah, I've got a note to add, but Mary, I'll let you go.
Yeah, that's a really good question. I think what it would come down to is, well, certainly we would have that information on a census block level in terms of income and race and ethnicity. We have that. Whether the vaccination information available from either IDPH or the county would be so specifically down to the address, and the question, I guess, would be whether that's shareable information, because you certainly could map that out. You could layer maybe vaccinations by, by zip code or by address. You could layer it over the maps of the race and ethnicity and income levels to see, to make that comparison. I guess it's a matter of who would have that data, and is that data that can be shared with, so the county's GIS department would have the capability to create a map like that if they had the data.
Yeah, so we just heard, and this is the good news, and I'm hopeful the next time we meet, we may be able to share some more. We've met with IDPH, and I hope you believe me when I say there's a lot of data people at the health department, and it breaks our public health spirit not to have more data to crunch and look at. But IDPH has been working with the team at CDC to analyze the vaccine recipient data by census tract.
Great.
And so they've told us that they expect to be able to provide a census tract level data set that will show the percent of individuals, an estimate of who's been vaccinated against the census tract numbers. So we haven't seen it yet. We expect it's coming in the next couple of weeks. That's what they're telling us. And that will absolutely get to your point, Jan, of being able to look at that and then be able to map. Yeah, if it's multifamily housing or low income or transportation issues or any number of things that are available, that will help us immensely. So good news is it's in progress. The bad news is that it's IDPH that has control of that data. And so we can't we'd love to be able to just do it ourselves. We're reliant on them, but we're working hard to get it. And it sounds like it'll be available in the next few weeks.
Thank you, Chris.
Thank you. Christopher, I got a question and
Sure.
a concern. I'm confused try to understand when you, in the race, the unknown people who's in a 33%, who is the unknown people? Who is this unknown? And also when you say non-Hispanic, who is a non-Hispanic too, what is the difference too, the race and ethnicity, when you make these distinctions? I don't, because this is not clear for me. Sorry.
Yeah, it's a great question. And this is a known limitation of the census data and the census breakdowns of race and ethnicity. So the way this data gets collected is if you go for a medical appointment, there's usually a box that says check your race and check your ethnicity, and these are the options you're given. And so that's what we can report out. That's what gets passed on then to the state. The reason that so much of it is unknown is twofold. There's two main explanations for that. One is that some people choose not to provide that, right? You often have a box that says, I'm not comfortable responding to this, or you just leave it blank. You as an individual have that choice. Providers are encouraging people to do that, but there are individuals, including some of us on this call maybe, that say, I'm not comfortable providing that in this setting. The other reason is that it may be collected, but it's not transmitted electronically to the state. So they report out on the data that they have available. If a provider doesn't report this or doesn't ask those questions, that may also contribute to the unknown numbers in this. And it's frustrating and disappointing that such a big chunk of race, 33% is a significant percentage. And ethnicity, it's even, it's double that. So it limits our ability to really.
Many people don't answer because they don't know exactly where they are, what is the correct answer for that. So, but it's things that we need to be thinking about,
Yeah, it's a great point. And yeah, people may choose not to answer because they don't know how to answer. And you don't want to put something that doesn't reflect you or doesn't describe your background. Any other questions on this, Dave? Or
let's check to see if there are any. We would be ready to move on. I do want to let folks know we are live streaming now. You probably have seen that show up. And I also wanted to say something in my introductory remarks that I missed. I'm going to slip this in right now. There was a media event this morning announcing the county's plan for vaccination and to reach that 80% number by July 1st. And I want to do a shout out to this team for the work that it's done in coming together and working. And then I want to do a shout out to Karen Ayala, Director of the Health Department, who gave prominent attention to equity in COVID-19 and to the work of this team. That was a great, great boost for us. And the work of this team is what gave her something to work with in that media event. So I didn't want to let that pass by.
yeah, thanks, Dave. And we'll put the link to the media announcement that's out there. Certainly, we're drawing on the work of the vaccine champions in this group to help us get to that number. We have a ways to go to get to that 80%, but it's our intention to work and really get there by July 1st. In terms of who needs to be vaccinated, we know that people over 65 have really gotten vaccinated at a very high level. So the people that we're looking to get vaccinated are between 16 and 64. For people that are over 65, almost 90% of them have received at least one dose. That's an incredible rate of vaccination for a group that really has suffered some really severe outcomes related to COVID-19. So we've done tremendous work, but there are still people that have not had the opportunity to be vaccinated. So I would ask this group for your help. If you know of individuals in this age group that haven't been vaccinated, or may not have made up their mind for whatever reason, we still want to get these folks in. And so whether that's through a vaccination site, we have the ability through the health department to do a drive-through option for people that may not be able to be mobile and get out of their car. We're expanding options for Homebound Vaccine. I'll talk more about that later. We really want to find as many ways as possible to get to this group and everybody else. So if you're aware of people over 65 or pockets of people, please let us know and let's work together to get them vaccinated.
Hey, Chris, before we move on, Dr. Asfar put a question in the chat about ethnicity. I don't know if you can see that question, but it's kind of addressing who needs vaccine the most. And Dr. Asfar, jump in if you want to explain your question differently.
No, exactly. Hi, everyone. Good to see you. I just came out of a big vaccination event, which was arranged by CARA and other community organizations. So just wanted to figure out today if we can have some specific, direction, like which ethnicity we should focus on now on more. Is there any way with this data we can figure it out, or unknown number is just ruining everything?
It is ruining everything. So it'd be great to have much better data. I think every group has probably individuals that need better access to vaccine, need more information about vaccine, need to hear from somebody that they know and trust about vaccine. So based on this data, certainly the American Indian Alaska Native is pretty close to the population count. So we look at the difference between the percent of the population and the percent of vaccine recipients to kind of guide us where we have big gaps. Asian communities appear to be pretty close. The Black community, certainly some work here. This is a group that has a gap between the percent of the overall population being about 4.6%, but only representing about 3.2% of those being vaccinated. Whites, it appears that haven't been vaccinated as much. Again, some of this data is a little bit wonky because it's just people that are vaccinated in DuPage. They may have been vaccinated elsewhere. So we don't have a great identifier on a specific group, Dr. Asfar, that really needs more. I think focusing on any group that hasn't had the opportunity, and in your work and travels, everybody's work over the next few weeks, really asking people, have you had the chance to be vaccinated? What would it take to get you vaccinated? What do you need? And really trying to bring that back. And we'd love to hear from this group if you're aware of groups that do need that focus. So I wish I had a better answer.
Chris, if I might add, from the experience I'm gaining with the clinic Shots of Hope that we have tomorrow, I think we are about to approach that group that's going to be a little bit more difficult to pull in or to convince, motivate to take the vaccine. And this is really becoming a learning experience, and strategy, as David indicated earlier, is definitely going to play a critical role in how we move forward successfully.
Amen. Yeah, this is we've gotten through the people that were enthusiastic and ready to come to a mass vaccination site at the drop of a hat as soon as an appointment was open. Now we're to people that may not have the day to be able to get to a vaccine clinic or can't drop everything on 24 hours notice to get somewhere. So making clinics accessible. You could walk in if you have time. Helping people understand how effective the vaccines are and that you can be in and out in 30 minutes. You don't need the whole day. You need 30 minutes. Can we make it work? Can we bring it to your employer? Can we bring it to the laundromat? Can we take it to the church? And we need your help in finding those spots and really helping to get people there. We can bring the vaccinators, we can bring the vaccine, we can be ready to go. We want to make sure that people know that it's there and that it's a benefit to them. Thanks, Jan.
And thank you, Jan, and thank you, Dr. Asfar and Chris. And Dr. Asfar, you identified to us a data gap early on as we approached the data back in the days of testing. And you noted that we don't have a category for Arabs. And we know that there's an Arab community that identifies with that identity. So that's a gap that we have here, and we're kind of flying with blinders, but we don't want to lose sight of that.
Today there was only one person from Sudanese American community who showed up, and I was discussing him that there are other folks. So he was saying they're very scared and it's very hard for them to come. So I think we really need to think more and come up with different strategies. So thank you so much for
good.
that. Yes.
A definite focus and urgency. Thank you.
Excellent. A little bit of a shift. One of the things that vaccine was going to be really critical for in getting populations vaccinated was opening the state beyond the phase 4 restrictions. So remember, the state has a reopening plan that bases how many people can be in a space or how much capacity certain venues could have. And that was based on the percent of the population vaccinated and then healthcare metrics being in the appropriate place. And so just to note that since the last time we've met, we've exceeded both metrics for the population over 65 that needed to be vaccinated, and now the population over 16 that needed to have at least one dose before the state could consider kind of moving into more reopening. Unfortunately, our healthcare metrics aren't quite where they need to be. We've seen a general decline in the average number of ICU beds available. New hospital admissions had been rising for about a month. Thankfully, over the past week, we've started to see a decline in that, so that metric is heading in the right direction. Unfortunately, hospitalized patients and daily mortality due to COVID-19 is still on the rise. So even as we get more vaccine out, it's a reminder that we need to be really careful and thoughtful about protecting those that haven't been able to be vaccinated. I'll share some really compelling and fantastic data about how well these vaccines work when you're fully vaccinated. But I think there's a risk that as people hear more and more vaccine out and it's nice out and we feel like, man, we're done with this pandemic, let's get out there and start socializing. We really have some work to do until we're really ready to get to that point and really protect those at highest risk. So these are the 4 metrics that the state is watching, and we're of course trying to bring down so that we can get back to the things that we love to do on the places we like to be. So we've met the vaccine metrics. We're not quite there yet on case activity and hospitalizations. In terms of providers, we're over 240 providers in DuPage County now. So especially as we transition away from some of these mass vaccination sites and doing thousands of people every day, it's going to be more and more important that people can find access to vaccine at a provider that they may get care at typically, or maybe in their neighborhood, or they may have a connection to. So we've really continued to expand the number of providers receiving vaccine so that people can have that trusted one-on-one relationship with a provider to get vaccinated. So you've seen a growth in these providers. We have a lot of data on the website. So just a reminder that you can go to the website on the bottom here to really dig into how much vaccine we've gotten, what type of vaccine, what providers are getting it. And we want to make that available to people. It's a little less important now that there's lots of vaccine, but it has been out there and we do want to share that with everybody. I'm going to skip some of these slides we've talked about in the past. You'll get all of them. I'll post them in the chat. But in the interest of time, I'll flip through a couple of them. I'll pause here on first doses just to show you how exciting it was to get 30,000 doses last week. That was double what we had received in any previous week. And now we're at a point where there's really sufficient vaccine to meet demand. So if a provider wants vaccine, or there's a clinic that wants to do people, we should absolutely be able to find vaccine. That is no longer a barrier, at least on the supply side. Getting it to the right providers at the right time, we're still working out, but there's plenty of vaccine out there. The community vaccination site at the fairgrounds does continue to be available. One of the things that we announced today was the option for walk-in appointments. So you can still go online, register for an appointment, set up a specific time that works for you or works for somebody in your networks. But people can also walk in. And Adam, do you have the times off the top of your head? I'll let you talk about those so I don't get them wrong.
Sure. Yeah. We're just starting Monday for the first time with that. So we're going to start with 8:30 a.m. to noon, walk in anytime. We're going to see how that goes, and we would potentially expand from there. But 8:30 to noon starts Monday through Saturday, can walk in 8:30 to noon.
Awesome. So we hope that's a little bit more convenient for people that, may find they have the time there or don't want to go through the hassle of scheduling ahead of time or making time. They just want to show up. So encourage you to help people know that is out there. Again, we'll share the link to the media release in the hours so that you've got it and can share it with your networks, but one more option to expand availability. And this site has the capacity to do about 10,000 doses a week. They've been really cranking through since the last time we've met. They've seen incredible efficiency. We're seeing a little bit of decline in appointments for vaccine, but we want to make sure that it's available, that as people are ready to be vaccinated, we're ready to take care of them. IDPH is also offering mobile clinics. So another option, just to make sure, again, that everybody knows about these. I think we sent it out after the last meeting, but a reminder that there is a request process through the state to bring mobile clinics out. They're especially focused on these groups on the right side. So if you're working with one of these groups or you represent a coalition that works with individuals in these areas, these are the groups the state is looking to prioritize. They've also expanded the different providers that are offering these clinics. So some of you may have had experiences that were not great early on. It's our understanding that they've added some providers, that these have improved. So I would encourage you to take note of this link and use it if you think it's appropriate. For Homebound Vaccine, we really are making a concerted effort to get to people that haven't been able to get out or really can't get out to a vaccine site. So we've been working with home health agencies, pharmacies, health systems, and just today started a program with fire departments to go out to vaccinate people in their homes. We had 2 departments that made 5 visits each today. Our health department nurses have been out over the past month doing vaccine for people in their homes. We're really working through the list of people that signed up on the county registration and indicated the need for Homebound. So this is a plug. If you're working with people or you know of people that need this opportunity, please have them register on the health department site. There's an option to say, I need a homebound vaccine administered. We are working through that list, connecting people to providers, whether that's the health department staff, a fire department, a pharmacy. We've got providers that are willing to do this, and we want to know where those folks are and make sure that we can link to them. So just, please help us find these individuals. If you know about them, help them register. If you work with providers that take care of people in their homes, please share this information. Again, we want to get these folks vaccinated. We also have the ability to do drive-through appointments at the fairgrounds. So if it's somebody that, can get out of the house, but, may have a hard time getting out of their vehicle and in and out of the fairgrounds, we can do that as well. One major change that's coming up in the next few weeks, just to be aware of, is that for the past 4 months, the state has been allocating vaccine to the county, who's then been allocating to individual providers. The health department's in an air traffic control role, so to speak, to try to get vaccine to the right providers. In the next month, IDPH says they anticipate providers being able to request vaccine directly. So provider offices, medical clinics should be able to order vaccine as they need it from the state and be able to take care of their patients. So you should see more access in some of these providers or typical provider networks. We are working right now to make sure that students, those 16, 17, 18-year-olds in high school, where we're seeing a lot of case activity, frankly, right now, have the opportunity to be vaccinated. We have ranked these districts and are working with the districts and the Regional Office of Education to really prioritize districts with high numbers of students on free and reduced price lunch, make sure that we're equitably distributing vaccine to those at highest risk, to communities that have higher levels of need. Right now, Pfizer is the only vaccine that's approved for 16 and 17-year-olds. So the more Pfizer we get, the faster we can go. Many of these districts have worked with Jewel. They've been a fantastic partner to bring clinics in, but we've had other providers partner with these districts to get students vaccinated. So if you work with kids, if you work with students, please encourage them to be vaccinated. If not for their own health, maybe they're at less risk of severe outcome. We really want to make sure that they are protected from illness and then passing that on to somebody that may not be able to be vaccinated or can't be. So please encourage them to be vaccinated. We also expect a big change will be in the next month or so. We expect that the FDA will approve Pfizer's vaccine for 12 to 15-year-olds. That's not a done deal. Pfizer submitted their request to the FDA, but it sounds like that will be approved, and that'll add about 46,000 new individuals in DuPage County that will be eligible. There's 46,000 kids between the age of 12 and 15, so a big number of students that we want to make sure get vaccinated if and when that's approved, and then have the option to be vaccinated. So that'll be another group to be working with, both students and their parents. Yeah, Mary.
Yeah, a question about the high school vaccinations. I know the state sites were requiring on-site consent, so the parent actually had to be with a 16 or 17-year-old. Is that the case with the high school program that you guys are doing as well?
It does depend on the provider. Our site, Adam, right, requires the parent to be there with them. We want to make sure that they have consent and that they have approval. Do you want to speak to that, Adam?
Sure. Well, yeah. So it depends on the provider. At our site, we're requiring that a minor is accompanied by a parent or legal guardian. There's lots of reasons for that we believe medically, clinically, legally are appropriate and safest for everyone involved. But other providers may not feel that way and may be allowing unaccompanied minors to be vaccinated. So I can't speak to each of those different providers, but it is up to the provider to decide.
Okay.
I won't speak to the specifics, but I will say that we've worked with a number of partners who, as Adam referenced, they require the signature, but whether the parent has to be present or not is not uniformly the same across the board.
Okay.
Yeah, thanks, Kara. And a lot of these clinics then you'll see are happening, either in the evening or the weekend when parents are more likely to be available. I don't know, I'm not aware immediately of any schools that are doing them during the school day, for example, and doing students, while they're at school. That might be an option for some places, but at this point, at least through our clinics and some, there's definitely a consent process in place to make sure that they have that.
Thanks.
We're also looking, down the road as less people take advantage of mass vaccination sites or need that opportunity, looking at supporting smaller clinics in the community. So many providers have partnered with community-based organizations, including many of you, to do clinics, mostly larger clinics. But I think you'll see that the size of clinics start to go down as we look to get people, at work. If they work in food service or hospitality or small businesses that didn't have the opportunity to coordinate vaccine, we want to get to them. We want to make it convenient. So as we shift away from mass vaccination in the coming months, this is an opportunity that we expect to make available to community groups, municipalities, chambers of commerce, really trying to work with employers to get employees vaccinated, bring it close to them, bring it close to the places. And here too, we need your help. So where are the right places to go? How do we get people to those sites? If we can go and do 25 to 50 people, that's a win. We don't need to do thousands of people at a shot. So as you go through your week here, please be thinking about where these opportunities may be best, the hours of the day, the days of the week, what specific groups would benefit from this opportunity. And we really need your help to get folks there. We can have the supplies and everything ready to go, but we want to make sure that there's individuals ready to be vaccinated, and we need your help with that. I'm going to skip some of this and highlight one last thing before we move on. And that is just helping people to understand the benefit of vaccines, right? So there's people out there that may not have been vaccinated yet. They're looking for more information. They're not sure vaccines are, safe, or they're not sure they need it. And what we're finding more and more, and there's more and more data coming out, is that these vaccines are tremendously effective and really a much safer way to build protection rather than rolling the dice with infection. Yes, it's true you could get infected and have very mild symptoms. Unfortunately, it's also true that you could get infected and wind up in the hospital. There's no way to know or predict exactly who's going to have what type of illness. So we want people to take advantage of vaccine as an opportunity to build that protection safely. And some 3 really important points. So in the past 2 weeks, Dr. Chugg and her team have really looked at the data around new cases, hospitalizations, and deaths in DuPage County residents, and looking at which of those have been fully vaccinated or not. So I'm going to walk through 3 of these, and I would encourage you to take notes on these, ask us questions, and really help us present these in a way that's not so scientific, but in the ways that people need to hear them. So this chart looks at the confirmed cases of COVID-19 in DuPage County residents since December 15th. And among all DuPage County residents, 0.2% of our confirmed cases after December 15th occurred in individuals who were fully vaccinated against COVID-19. So if you were fully vaccinated, the chances of you developing COVID-19 were extremely small. Only 51 out of 27,000 cases were fully vaccinated. So we expect that there will be a small number of people who are fully vaccinated that develop illness. The vaccines are awesome. They're not 100% effective in every situation. So we expect to see a small number of cases, and that's okay. Those people will hopefully develop much milder courses of illness. But what's really important here is that if you've been fully vaccinated, the likelihood of you developing confirmed COVID-19 is tiny. And we want people to recognize that.
Chris, really quick here,
yeah.
Of those who had not been fully vaccinated, do we have any data to explain why? I mean, were they just waiting for the second one, or had they decided not to take the second vaccine or complete the series?
It's a great question. In general, we see very few people who are not getting a second dose if they've already gotten one. So this data, I don't have a specific breakdown on every, why people were not fully vaccinated in this group, whether they hadn't got it yet at all, or were between a first and second dose, or were a day after their second dose. Any number of those things are possible here. And this goes all the way back to December. So, early on, very few people had the opportunity to be vaccinated. So we probably had people developing COVID, who may not have had a chance to even get a first dose yet. But we know that once you've been fully vaccinated, the number of people that develop illness is very, very, very small. Does that help, Jen?
Yeah, but if I can put my epi hat on for a moment and suggest that we start looking at that kind of data to know 2, 3, 4 months from now, if there is an issue with individuals saying, I will not take the second vaccine for whatever the reason.
Yep, it's an important point. I think we've seen a lot of media stories in the past week that people are not showing back up for those. The state did send out some communication in the past week to people that they had record of not getting second doses. I think they sent about 90,000 letters, and a lot of them they found out were people that had been vaccinated. Their second dose wasn't recorded in the system properly, but they did have a number of people that said, oh yeah, I better get that second dose, and they did call to schedule. So I think in general, people are getting that second dose if they've gone through the effort to get one. But it's a great point, Jim. We need to really know. Adam, anything you want to say about our site in terms of people that have been through our site for one?
Sure. Yeah, we've been starting to look at that individual line level. We found 150 individuals missed their second dose appointment, which is actually really great. I mean, it's like 0.007% of the people that had missed that appointment. And, we have their information, so we're outreaching to them and trying to get them in. So I think, as Chris said, we saw a lot of media about that. People aren't going to their second dose appointments, but at least at our site and the population that we have information on that we've been vaccinated and working with, we've not actually found that to be a big problem.
Adam, this is Kara. Just to add that we get a lot more feedback about people that did miss their second dose, but are trying very hard to get it. And early on, when demand was so high, it was really difficult when people had missed that first window to find a second window. But the good news, I think, is that at this stage, we should be able to accommodate those requests pretty easily.
That is a great point. Yes, it was probably for the folks that it has been a challenge. There was challenges with providers and scheduling, and there was lots of buzz about Walgreens scheduling system, and everybody was saying, and IDPH was saying, go back to where you got your first dose to get your second dose. That wasn't always feasible for people. But now that there is ample supply of the vaccine, we're able to accommodate. So that's a great point, Karen. I'd mentioned that, if folks I got it someplace, I got my first dose and I'm not able to find my second, we're able to accommodate those folks as well.
Excellent. Good questions. Okay, so we talked about cases. Let's talk about hospitalizations. I can't get my page to say. There we go. Okay, so same setup of all the people that have been hospitalized, all the cases we know that have been hospitalized since December 15th, which is 1,298 COVID cases were hospitalized. 7 of them had been fully vaccinated. Less than 1% of people who had been fully vaccinated ended up being hospitalized as a result of their COVID-19 disease. So these vaccines are tremendously effective, again, against cases and hospitalizations. And then finally, we'll look at deaths. So of the 212 deaths that have occurred, 212 COVID-19 related deaths since December 15th, less than 1% were in people fully vaccinated. Again, we might expect a very small number. These vaccines are fantastic. They are not perfect, which is why we still need to take some prevention measures if we're out and about, but we know that they are tremendously effective. Less than 1% of hospitalizations and deaths have occurred in fully vaccinated people since December 15th. So help us share this information. I hope this makes a difference for people that aren't sure or aren't convinced yet about the data. This is updated weekly on our website, so I'll put the link here. You can refer to it. We need your help getting this out because these are important foundational elements to help people understand, what the benefit of being vaccinated is. Any questions about those? Okay. Then the last thing that I will talk about, 2 last things. One is vaccine registration. So just a reminder that people who are homebound or people that want to come to our clinic, absolutely use this link to sign up. As soon as you sign up now, you should be getting a vaccine opportunity to register for a time. No longer is it sign up and hope to hear from us in a couple of months. If you sign up, you'll get an indication pretty quick that you're able to schedule an appointment. Now, as Adam described, we've got the walk-in appointments as well on those days.
Chris, two quick things I gotta say. First, if you register, you'll get a same day notice. So like if somebody registers today, they're gonna get an email today to invite them to schedule. And the second thing is for the homebound folks, when they do that, when they register, there's an opportunity for them to indicate that they would desire homebound services. They can do that, and that's great. That's one we know, and we will call them. The system, unfortunately, will still send them an email to schedule, and that, I guess, could potentially create some confusion. They want to that's not a scheduling option for them because we know they can't come on site. So definitely they should register. That lets us know they're interested, mark that they're interested in homebound services, and we will call them.
Awesome. Thanks, Adam.
And then Mila, do you want to introduce PSA?
I got a question.
Oh, yeah, go ahead, Reverend.
Yes, Adam, when some people try to register and they struggle with technology, sometimes they assuming they are registered already, but they find out that they are not registered. When they show up, and you deny the vaccines, or they able to get a vaccine? This is a one question. So what I hear is that people can walk into the like a playground to get try to get a vaccine without registration. Are they going to get a vaccine too?
Yes. Yeah. We're taking all comers at this point. So certainly if people register beforehand, it makes the process a little quicker when they show up, but we're no longer requiring that registration starting Monday. They can just show up on Monday, and we'll do the process, gathering information and vaccinate anybody who shows up.
And they can also call. I skipped over this slide. This is important too. You can also call. If you can't get through the website or that's not a good tool for you, people can call. We can assist them in multiple languages, and happy to do that.
Chris, if I could just add on this one, Kim and her team are working on having this information translated into 5 languages. So awesome. That's almost ready, and she's working on making that available. We have a plan to hand it out through the Hunger Network. This is something that Jenny Fabian had suggested, and it should really help out a lot.
Awesome. Mila, do you want to introduce PSAs and I can pull them up?
You know what? Why don't we do that now, and we'll talk about them after the FEMA part though. But it would be good because you're already showing your screen. Kim and her team have been recording PSAs, and I think you've had a chance to see Mr. Davis's PSA. We played that on our Facebook page. It did really well. And she's had a chance to record several people, including our very own Michael Childress and a number of other folks, including Dr. Asfar, Gilda Ross, Vanessa Corpus, and Diana Martinez. So we're just going to show, I think, Chris, I don't know if you have Dr. Asfar's up, but we're going to try and show hers because it's different than what you've seen before.
Okay, and let me know if this works, Mila.
Okay.
Can you hear that okay?
Yep.
Yes.
Okay.
Assalamu alaikum. A safe, effective COVID-19 vaccine is one of the best tools we have available to end the pandemic. The vaccine will help build immunity without the risk of severe illness. The vaccine will help protect you and your loved ones. Our community depends on us to get vaccinated against COVID-19. It's our shot to help save lives and restore health to our community. This is our shot, DuPage. The sooner we get vaccinated when it's our turn, the sooner we can get back to the people and places we love and cherish.
Excellent. Thank you. Thank you, Chris. That you can see Gilda's is there too. So those are going to be located on our YouTube channel. And Kim, I know you were going to jump on, so please add to the conversation if you like. But today during the press conference, if you didn't have a chance to tune in, there were multiple posters showing all of the different folks that are doing PSAs and kind of volunteering their time to help with this effort. They really look great, and the PSAs are turning out really well. It makes me think, Chris, when you were showing the male to female ratio of people getting vaccinated, that maybe we need to have more male representatives. And I know we have Dwayne Bates and Coach Hetlett potentially might make an impact with some of the male demographics that we're trying to reach. Kim, did you want to add anything?
Hi everyone.
Hi,
The only thing I would like to add is just to let you know that we have several other PSAs that are in the various approval processes. So we've got one with Access DuPage, Vanessa Corpus, who is a patient navigator, just about ready to go. We have one with Diana Martinez, who's the director of the MAC at College of DuPage. That is almost ready to go, as well as our Michael Childress with DuPage County NW. Hi, Michael, how are you? I see you there. So yours turned out awesome, just waiting on approval to release that. So in addition to the ones I just mentioned, we have a few others opportunities with Arista Wang, and then we're also looking for some medical providers. DuPage Medical Group mentioned today during our press conference that they would like to be part of this effort. So, and Senator Villa we will be working with her next week. So yeah, we have a lot of PSAs coming up. So we're really excited about it.
And Kim, how many languages do we have recorded right now?
So we have Spanish and we have Urdu recorded right now.
And I know Arista was planning on helping us with Chinese.
With Chinese, correct.
And I think Mimi had asked in the chat, how do we nominate people for PSA? So Mimi, you can have them contact, or you can contact me or Kim, and we can kind of discuss from there. So, and I think with the existing PSAs that we have recorded, we can do a couple of things. The creativity of having the posters today, those were great. And I think Lynn LaPlante's looking at, she's shaking her head thinking she's going to put them all over Glenbard West when Coach Hetlitz is ready to, get those sports kids thinking about getting vaccinated. And we could do the same thing. Jan had mentioned laundromats. We could, if we have a business that's willing to put up a poster, we'd love to do that, because these are some excellent representatives from our community that have been willing to come out and build some confidence in the vaccines. So we'll talk a little bit more about the education later. I don't want to do that whole discussion right now, but thank you very much for showing those. And Dave, unless there's questions, we can move on.
There is one more. Well, first, when we get to the education part, I'm going to talk about a little bit of video work we're doing too. But before we get away, Evan and Aaron have mentioned a specific vaccination barrier that they're working on. And I wonder if I could ask you to bring that to the table and ask the people who are in the call today, what kind of resources or solutions could we raise up?
think Evan had to go, but
Okay.
it's only me. Okay. I work in the southern portion of Bensenville, and I am, by the nature of my work, I've been working mainly with the Guatemalan origin population, and I also work in the high school, and I have a lot of unaccompanied minors. So they don't want to get vaccinated. They are afraid. And there is a lot of struggles to go to the hoops of registration for a vaccination. They are living in a bubble. It's hard at transportation. As we speak, just yesterday, I'm also trying to organize collaboration in Amherst, which is Amherst Resource Collaboration. So we're trying to plan a vaccination event. And I just happened to bring also the Consul General of Guatemala to help us. So we are thinking and trying to launch an event in this community that is in this bubble, specifically the Encore Apartments, which is located really close to the corner of York and Grand in Bensenville. Ferrari and Guerrero Stevens, they have a little tiny community center, but that's where all the people that needs the most is living. So if we can bring an event there, we're already speaking about trying to do this by the end of May. That'll be awesome. So
Karen,
I know there are like 1,000 people living there.
Erin, this is Kara Murphy. Maybe this is something we could follow up with after the fact. If it's 1,000 people, this may not be a good fit if you think it's a large event. But if what you're speaking of is something that is smaller and more targeted, given the location you're describing, I think that VNA Healthcare would be an excellent partner for that. And we've been working with VNA, and I don't know if Chrissy's on this call, on bringing smaller vaccine events to, for example, homeless populations that really have a lot of barriers to transportation. And they've been very receptive to some of those more tailored opportunities. So it might be a place to explore, but I think it will depend on the number of folks you're describing. If you have a lot of folks that you think need a vaccination and you have the ability to document that, then you'll have a wider array of partners that might also be good fits as well.
Yes, thank you. On Sunday, there is an event for distribution for food. I'm gonna be there actually sensing the thermometer of the population and trying to establish a list and trying to convince people for an event at the end of May. So I'll have more information probably by the next call. Thank you.
Thanks, Erin, and thank you, Kara. And Erin, the thing we want you to know is that there are a lot of resourceful people here who've been through a lot of the travels that you're now taking. And if we can help, that's exactly what we want to do. So glad you're here. All right, we have had a fantastic discussion over the last 30 minutes. It's been just what we've needed. We've done a great job of identifying what are those places of greatest need, what resources can we bring to them, what strategies can we bring to bear. It does mean we're going to need to do some adjusting of our agenda as we continue to move through. And right now, I want us to introduce Amanda Lindsay of FEMA. And Mila, I do not know if someone from your department wants to do that introduction.
Sure.
Good, thanks.
Yes, thanks, Dave. And Chris and Adam are all on here too, and have been working with FEMA for a couple weeks now to make sure that we can really best make use of their outreach and collaborate with them for not only the resources they're bringing, but kind of the people they're putting into the community to help us build vaccine confidence. So because all of you are on this call and are in communities and can give perspective to their work as well, I wanted to have a chance for them to introduce themselves, talk a little bit about their resources, and then we can follow up with any flyers and things that they make available. But Amanda's on the call here. She can't show her video because she's at the United Center and they're prohibited from doing that. So just know that that's why she's not showing her video, in case she doesn't tell you that. She's an excellent spokesperson, and she came out here with her team on Tuesday to meet with us and talk about their efforts. So Amanda, go ahead and jump in and take it away from here.
Thank you for that introduction. Again, my name is Amanda Lindsay. I am the FEMA supervisor here in Chicago. Really, this project is with FEMA and IEMA. IEMA has asked our assistance to kind of get people registered getting out the word and working out with working with the local counties in throughout Illinois. So we have a team assigned already through the United Center that is working this area. And we're focusing on the 7 counties around the Chicago area and then looking to expand out. So obviously DuPage is one of them. And we are trying to coordinate with the local counties to basically be the boots on the ground. Like you have an event or a pod opening up tomorrow. And so we have people in DuPage right now passing out flyers within your county to kind of spread word about the pod. So our thing is that we're just trying to get information out, like let people know where to get the vaccine at. The other thing as well, which after the Wednesday meeting I found out about, is that the state of Illinois is now accepting applications to have mobile pods in different locations. So I saw in the chat that somebody provided the link already, but we have the opportunity for like local organizations, businesses, community centers to either work with the county, or you can apply directly through that link. And try to host your own clinic in your area. And so then if you end up getting approved, then that's something that we can work with, that once we get flyers for that and everything, that we would send people on the ground to do outreach and let people know that there is a pod opening up or a mobile site opening up. Is there any questions about our mission?
So Amanda, this is the same information I think Chris shared on his slide about how to access mobile clinics. Chris, It's the same resource, right? Just so we make sure everyone isn't confused. And in the email that you got from me, maybe more toward the middle of the week, there was a Word document that we were trying to consolidate some of the clinics that are kind of popping up, in addition to, the mass vac sites and the vaccine partners that we have, throughout the county. We'll keep trying to do that, and you'll notice that the health department has shared a number of vaccine opportunities on their Facebook page to make sure we get the word out. So we're fortunate that we have so many groups that want to have vaccine clinics, and the desire to have ownership on that effort is wonderful, because it increases confidence and credibility to the effort for sure. But we do want to make sure that we try to promote the events and kind of be strategic about where they are, so that we don't have 3 events in Naperville and, none in Bensonville, or, and that's part of the reason why this group is together, is to be strategic and create equity across the county. So I thought, Amanda, if you had any questions for the folks on this call, especially after hearing Chris's presentation about kind of where we're at with our vaccine efforts, this would be a good time to do that. And I also wanted to invite Reverend Briones to speak to kind of, what he thought about some of the efforts that we talked about on Tuesday with FEMA, because he was also at our meeting.
Okay. Yeah, pretty much our questions are going to be continuously the same thing. It's like, where do you guys want us? What areas are you needed? What pods are coming up and that type of stuff. In regards to wanting to keep everything coordinated, I know there was like one person that reached out already to see if they can get like a mobile site, and I think I forwarded that information to you.
Yep.
That's why, we can try to coordinate on both ends. So that way we're not making sure that we're oversaturating one area and then not getting the other areas. It's just, from being from DC, I'm not really familiar where everything is at. So still trying to learn. But yeah, no, I'll definitely, every time that we get like a request in, myself or one of the others on the team will reach out to you guys to make sure that you're okay with that, and that, or to coordinate further on with that as well, because they have contracting work, and then they have Title 32, which is national guards as well, running these mobile sites. So there's multiple components into it as well. But in regards to like the populations and that type of stuff, it's pretty much similar to what we talked about on Wednesdays. Just making sure that we're getting the areas that you want us to cover whenever we go there.
And Amanda, did you just want to speak to, I think you had someone who specialized in some civil rights work, and then there were some benefits for burial that we were sharing with the funeral directors, and just those 2 details would be useful for this group.
Yeah, so we have Siobhan Jackson. She is currently deployed here into Chicago as the civil rights representative for FEMA. So she can really talk about, unfortunately, she is out of the field today. But she can talk about, like, you know, disabilities. We had her order tons of Braille stuff, so like she could talk about disability sensitivities, you know, how to get access to Braille if that's something that you guys want, you know, where to order it from basically. And then she could talk about reach out to different communities about civil rights and how that pertains to the vaccines. And then she's also really involved in the funeral assistance, which is something FEMA has started since April 12th. Basically, it's an ongoing application process that we are accepting applications for individuals that had loved ones that passed away due to COVID. There is a call number that you can have the individuals call, and then they gather like the death certificate and a couple other things relating to finances, and while they're on the phone, they apply via phone. There's no online application at this time. It's only via phone. They can apply and then hopefully you know, get accepted and can get some financial reimbursement for that. We just earlier this week received additional flyers with 8 additional languages. So originally it was only in English and Spanish, but now we have them in like Arabic, Mandarin, Cantonese, and several other languages as well that I will be forwarding to Mila to provide out as well.
Okay, thank you. Any questions for Amanda?
Amanda, how long do you anticipate that you'll be in the area?
Until admission's done pretty much. So until we get the orders from FEMA to relocate. So that's really kind of tentative and up in the air at this time. So I don't really want to give an end date because it's not really a set.
Understood. Sure, it's an uncertainty. Well, one of the thoughts that goes through my mind is that civil rights and disabilities capacity is something that would be good for us to know about, and we'll be gathering again in 3 weeks. And if you are still around and your cohort is still around, your colleague is still around, that would be perhaps a good thing for us to hear from. The second.
Oh, sorry. I was about to say, I was like, yeah, I can have Siobhan reach out to Mila to kind of get a little bit more details on that and try to coordinate that.
Very good. Did I hear you say that you are spreading the word about vaccine, and so that perhaps you have staff who are doing outreach work? And here we are, we're a county with quite a bit of language diversity. And if you have staff members who are bilingual or multilingual, we'd love to think about places where we could put them to work doing some outreach. So the languages that you'll find here, of course, in addition to Spanish, we will have Polish, we will have Mandarin, Chinese, we will have Urdu, we will have Arabic. If those ring a bell with staff members of yours and they're looking for a place to come and help spread the word, we'd like to put our hat into the ring.
Mostly our staff are bilingual with English and Spanish. With the other languages, we do have programs through FEMA that we can actually call via our cell phones and communicate via that way. So it's kind of a call translation or interpreter type of thing. So, and that's always, if we ever run into that situation, we have a way to cover it.
Very good, thank you. Other questions for Amanda? We welcome you to be with us and share those resources, Amanda. Thank you for your work throughout the region and the country as well.
Thank you so much. I apologize, I'm going to have to drop off, but before I do, I will, Mila, I'll connect with you after this. But thank you so much for allowing me the opportunity to speak, and I look forward to working with y'all in the future.
Thanks so much, Amanda.
And May I hand the microphone to Mila for COVID-19 education?
Yes, and just Dave, looking at the time, if I spend about 5 minutes, does that give
Thank
you
you.
time to kind of wrap up with what you need? Okay.
Yes, yes. And Kara, I want to cue you up about Spanish Town Hall as well.
Okay, so really putting together the conversation that we all had with the information that Chris and Adam provided throughout the COVID-19 update, and then hearing a little bit from FEMA, I wanted to ask a couple things. You know, we're trying to work on removing barriers, and one of the ways to remove barriers was to create the walk-in opportunities and include information in other languages. But since we have you all on the phone and we've listened to a little bit of the presentation on the data we have on how we're doing with vaccines among different ethnic groups, and Dr. Asfar asked a question earlier, how do we know, where to put our efforts? I wanted to see what you all thought about how we could remove some of the barriers that you're seeing in the community, because you have a local perspective that we often don't have.
Mila, this is Kara. Just a quick comment to say that it still feels to me as though we have a lot of work to do outside of the health department, but perhaps within it too, I don't know, with community partners, retail partners, and others who are not providing consent forms, enrollment processes, or otherwise that are available to populations that speak a language other than English. So it doesn't really matter how easy the system, quote unquote, is. If it's only available in English, we've effectively barred a whole host of folks from being able to access it without help from someone else.
Kara, I've heard that too, especially among some of our more difficult languages that we can't often have, even community members translating very easily. So we will continue to work with Jenny Fabian and some others that have pointed out some communication pieces we can use, but looking for suggestions from this group and recommendations really on how we can, we can address some of these barriers.
So I can jump in. Any form that requires a professional translation, we can do. Our language capacity here, we have a language partner on this, so there are 250 languages we can draw on. It's a professional service, and it can turn around in a couple of days if the document is not huge. So we want everyone to have those documents in the language in which they receive their health care.
I see Amanda put something in the chat about transportation and having more weekend and evening hours and the scheduling process being difficult for language groups. So looking at the evening and weekend hours, I know a lot of our vaccine partners have some pretty strong, especially the pharmacies, weekend and evening hours. Do you see that those pharmacies are a good opportunity? Do you think that there's another way to go about providing that kind of access?
I think my thought was more also tied in with the barrier to transportation. Just thinking about if we could bring the clinic more to the clients and having it based on work schedules, maybe not just one time and one day, but maybe a couple.
Thank you, Amanda. And Juliet, I know you just joined, so I don't know if you've had a chance to jump in yet, but please feel free.
And welcome, Julietta.
Thank you. I was just typing something, but yeah, I guess I'll just, I'm having typing issues. I think what has been successful a little bit is here at I'm from West Chicago, in St. Andrews, to their capacity, they're trying to get the like their parishioners vaccinated once a week, at least 50 people at a time. I'm more wanting to see if we create more of these vaccine centers more often on the weekends. And also, I guess the demand for vaccines is high, I understand. And when people try to access the apps, all of a sudden, like they're filled up already. That's what I hear. So is there other ways to try to make this more friendly for them? In our community, not everybody's very with the apps and everything. We try to help them in our end, but if they like the older folks, they're not so sure if how, or maybe they don't even have an email, so I guess a way to reach out to them to get them to register, or is it easier for us to register for them? And how easy is it for us if they want a vaccine to just register them? Can we do it for them?
You can do it for them, but Adam, I'm going to let you jump into this because there's other options too.
Well, yeah, there's several points. So those are great questions. And fortunately, we've had some experience dealing with that. So people have a couple options. Certainly, if you want to volunteer for them, you want to put your email in. We've seen plenty of that. We've worked with local volunteer groups who've done registrations and signups for communities. And especially when we were doing the seniors early on, it was like, they don't have an email account. They don't want to set up an email account. So the volunteers were using their personal email account. So that's, you can totally do that. They also, if they show up and when we need to like put them into our system, we have like sort of a dummy email account that's a general one we can use for anybody. So we really don't want that, especially the email and the technology, to be a barrier. So yes, whether it's volunteers or local groups supporting them by doing the registration on their behalf and using their email, that's an option. Just showing up, especially now with walk-in, is an option, and we'll take care of it. And the third option for that is people can just call our main phone number, at the 630-682-7400, and those people will walk you through it. And same thing, if you don't have an email, they'll have sort of a dummy email account to put in for that. So we have several options for the email piece. I do want to address a couple of the other comments I heard. We are working on mobile. We're just sort of piloting and launching our own mobile essentially this week. It's sounding like there's probably going to be a lot of requests for this. I'm not quite sure yet, but that's a good problem to have if that's the case. So we'll do some prioritizing and triaging the best we can. We'll do some matching with partners. I think it might have been Evan that dropped in before that IDPH also has their mobile and equity-based clinics that might be a good option for the community. I know they do offer some evening hours as well. Right now, our fairgrounds, the best I can say is we've got the Saturday options, the Saturday does seem to be popular. And as we go mobile, we might offer some evenings. We kind of need to see what those requests look like first before we really know where we're going to prioritize. But if we're hearing that evenings really are a need, we'll focus on that.
Yeah, I would think because like in our community, most of them they work and then they're off by, like my husband, 4:35-ish. So they're probably thinking like after work, go get your vaccine. Also, unfortunately, not all workplaces are respecting that they need to get their vaccine, and also maybe the next day off due to the side effects.
Right.
So the second one got me really bad. The first one I was fine, the Pfizer, but the second one, all of a sudden I felt like chills and everything. And then I can only imagine someone having to work at a factory fast machine and you're feeling all this going on, not comfortable at all. So most of our community is trying to avoid having to confront the boss, which is ridiculous. I wish it wasn't that way, but that's how it is. So if we could offer that weekend and afternoons, early evening, not too late, that would probably even help them more, because usually the side effects are like right after the vaccine. Maybe the next day they won't even notice it that much. So
yeah, right now the best early evening access I'm hearing is the retail pharmacies, but even they are limited. I'm understanding that those appointments are getting snatched up pretty quick, and that maybe when we say early, like 6 o'clock is maybe the latest they're going sometimes. So it's definitely an opportunity to keep. Yeah. Understood.
I was trying
and you're
myself for me.
Yeah, it's not easy. And you're right about the employers. That's something else that we really want to work at a higher policy level, is helping employers understand that it is mutual benefit if their employees are vaccinated, and that they should support that. We had one local example. We learned of an employer who was giving 2 hours paid time off for their staff to go get vaccinated. And it's like, yes, we need more of that. So the more that we can encourage and help employers understand that it's in their best interest as well, perhaps that will help work the access on that end. But from our part, we're going to link up with employers that say, yeah, we've got a lot of employees that we know need to be vaccinated. We'd love it if you came here. That's something we're actually piloting on a smaller scale today. We have a couple teams out, one at a car dealership and one at a landscaping company. Those employers, we've synced up with them early on, so we are piloting it with them right now. And hopefully that works pretty well, and we can continue to do more and more of that.
I'm glad you said that, because Verizon is offering all of our employees 4 hours to go get vaccinated.
4.
Oh my goodness.
4 paid hours.
That is good.
Right.
Yeah.
Adam, as you hear, what's important is to take advantage for every vaccination clinic, especially like the Latino community or in other communities where they struggle with those situations. What I heard, it's very important that eliminate most of the barriers that we have. Registration is a big barrier, as we mentioned, for technology. People don't know how to reach the people or to do that. I really like the idea, to be open, to everyone who's want to receive the vaccine. Anyway, when they come in a place to receive the vaccine, they need to register there, right? And I understand it's very important to keep the records for the institutions who provide the vaccines or for the state. So I think this is perfectly fine, but we need to be more accessible, for the people. And as Karen, Julieta, thank you for mentioning this time. I asking the weekend is a perfect day, even Saturdays. I think it's the most perfect day. From 10 to 6 p.m. is a good time, because some people working late in the weekend, they need some time off too. About those people who working after work, to go get the vaccine, talking about maybe after 3 is Saturday, or 4 or 5, able to 6, maybe people's going to be able to receive the vaccine. So all this point is very important to considering, in the future clinics, because that, again, what we're trying is to take advantage to these opportunities, and try to make every people able to reach the vaccine, and that way.
Right.
Message received. Thank you for that feedback. Yep.
We have a worker center here too. I'm part of them. And we've been trying to reach out also to these employers to make sure they understand how important this is. I mean, it's only beneficial for them, so that they don't keep having these outbreaks within the factories, because if it's been spread, it's in the factories, because they weren't, in the beginning, they weren't respecting the protocol. They weren't providing a mask. Here in West Chicago, unfortunately, a few people died earlier this year, and that was because they weren't keeping up with the protocol, unfortunately. But Now they do. They actually went to vaccinate all their people, all their employees, fortunately. And I wish all the employers would, all the factories here would do that. Would just, maybe at least bring the clinic to their factories too. Not make their employees have to go get it too. At least that way, the factories would see that, that everybody's getting these side effects. You need to give them a day off or something. You need to give them some time. And because, yeah.
I wanted to say thank you for your advocacy with employers. And you know that this table here is a place that can provide those clinics with employers. So if that's a help to you in your conversations, the health department and other actors here are most willing to partner to make that happen.
Oh, that would be wonderful. I get so many calls, and that's their fear. If I take a day off, I'm gonna get fired or something. And I'm like, why are you getting fired? We're trying to do this so you don't lose your job in the first place because you got sick, or you lose your life.
Right. Number one, your own health and safety. Thank you, Juliet. And I'm conscious of our time, and I want to be sure, Kara, to ask you if you have an update regarding Spanish Town Hall.
I do. I have an update, and it's timely and just in time, I think. Folks, stay tuned for more information that's going to come on Monday. But we are actually going to be hosting a Spanish language town hall in partnership with Dr. Jairo Mejia of Access Community Health Network and Stephanie Cavillo of the Health Department, moderated by Gabby from Immigrant Solidarity DuPage. I don't know if you're on the call with us today, Gabby, but hoping so. On Wednesday from 6 p.m. to 7 p.m. This is going to be a Facebook Live event. And so I'll be reaching out to all of the folks on this call and other partners as well, hoping that we might be able to expand the breadth of the reach of this effort by co-sharing and co-promoting this Facebook Live event. And then when it goes live at 6 o'clock on Wednesday night, having it shared on each of your respective networks as well. This is going to be a Spanish language event. We will subsequently caption it in English to make it available to a broader audience, but the focus of this event really is on individuals who prefer to receive information in Spanish, and also on individuals who need information that's tailored and local. There have been a number of great resources out there that are providing information in Spanish, but oftentimes they're not focused on specifically what's happening here in DuPage County, and that's what we're hoping to be able to do with this event in a few days.
Hey, Kara, it's Mila. Can I just add that since our is Stephanie going to be a part of this event, and there's an opportunity maybe for her to share some registration in Spanish on, how to register and kind of the logistics.
Mila, were you inviting Stephanie to speak?
No. Just that she's a part of that event. So I think it's okay. We can put some of these ideas that you guys all had today into that event. And as Kara mentioned, it's really timely.
Very good. So that is Wednesday at 6.
I'm sorry. Are you guys going to send out the link?
Yeah, we have to create it first. But yes,
okay.
Peter will.
Okay. Yeah.
We literally had a meeting on this at 1:30, Jan. So this is really hot off the presses, but we know that we are really facing a cliff of vaccine hesitancy, and we want to get the information out as quickly as possible. We're also working around a number of very, very busy folks' schedules. So we're glad that we can get it launched as quickly as we will. We'll be sharing social media and instructions and requests on Monday and Tuesday of next week. Stay tuned.
Kara, I understand. And I just want to say, we being the NAACP, appreciate you and David Roth for your ability to turn things around so quickly. So I do understand how, these things can just come up. So thank you.
Thank you.
Well, that's a great segue, Jan, for me to come back to this entire group. When I look out right now at the faces that I'm seeing, everybody's been engaged in some kind of engagement. education and vaccination in recent days. And right now you're probably piling 2 and 3 on in one day. So appreciative of that and the impact that it's having in our community. I'm not going to bring back that slide about our identity and strategy as an organization. I do want to say in closing that we launched back in October with a vision for developing a strategy for equity in COVID that would include metrics that we would measure what our progress is. And as we've been flying along so quickly with education, promotion, and vaccination, that element of this we've not gotten to yet, but we will, and we'll start by engaging you all regarding what's worked well so far and what are your biggest anxieties going forward. But the big message today is thank you for all that you're doing. That's continuing today, that's going to happen tomorrow, and it's going to happen over the weekend. What a fantastic thing for our neighbors and our community. And thank you for taking the time to be here as well today. We're looking at another gathering in 3 weeks on May the 21st at the same time, 2 o'clock in the afternoon. A special thank you today, Chris and Adam, Mila, Amanda, if you're still with us, Kara, thanks so much for your presentations, and everyone on the call. Everybody here has had something to contribute to help us get a clearer view of where we need to be connecting with people to ensure that everybody gets healthy and everybody gets an opportunity to recover and nobody's disadvantaged. So thank you so much for that. I wish you all a great weekend.
Thank you, David.
Take care, everyone.
You too.
Thank you.
Thank you, everyone.
Bye-bye.